Hello and welcome to our presentation. My colleagues and I will be exploring the implantable Cardioverter defibrillator, what it is, how it works, and the ethical and social issues associated. A Cardioverter defibrillator is an implantable device inside the body that is connected to the heart. It continuously monitors and regulates the heart's rhythm to prevent sudden cardiac death. It has two purposes. Firstly, it responds to irregular life-threatening heart rhythms. It promotes a normal heartbeat by correcting a fast or slow rhythm, and it can deliver a life-saving shock, defibrillation, that will reset a heart rhythm to prevent sudden cardiac arrest. The ICD also records and stores information about your heart for your doctor to review. An ICD can be easily confused with a pacemaker because they are similar and almost all ICDs have pacemakers built into them. Pacemakers send signals to regulate the heartbeat and act as the heart's natural pacemaker, the SA node. The ICD differs in its ability to also send a life-saving, stronger electric shock, a defibrillation shock, to reset a dangerous rhythm, often described as a kick in the chest.
Right, today I would like to explain the principle of ICD, so let us first familiarize ourselves with its major components. As you can see from the picture on the right, inferior to the left subclavian fin is where the ICD generator is placed. This battery-based generator releases electrical impulses carried by the leads throughout the left subclavian fin down to the superior vena cava. In the end, you can see the pacing electrode embedded in the myocardial tissue, which can be solely at the right atrium, at the right ventricle, or even both, and this depends on the patient's medical diagnosis. So let's first understand the differences between tachycardia and fibrillation. Tachycardia is a rapid heart rate greater than 100 bpm but with a regular heartbeat. In fibrillation, the heart rate is even higher, between 150 to 200 bpm but with an irregular heartbeat. So if the electrode detects parameters of tachycardia, the ICD generator releases a rapid but mild impulses to the pacing electrode. This is known as an overdrive pacing. If the electrode perceives parameters of fibrillation, it will emit a powerful electrical shock to reset the heart rhythm. This is known as a defibrillation. So the expected outcome is to return to a normal heart rate that is between 60 to 100 bpm.
The implantable Cardioverter defibrillator has undergone multiple improvements from its creation to today. The initial idea of the device was conceived in the 1960s by Michael Morawski and Morton Mower, and was first implanted into a human in 1980. This original design only corrected ventricular fibrillation, however this was soon altered to allow for identification and treatment of ventricular tachycardia. Modern devices have now expanded to target a vast range of cardiac disease, with innovations allowing for remote monitoring and management and increased diagnostic and treatment capabilities.
The irreversible termination of cardiac function has long been a way to determine a person's end of life. Therefore, discontinuing a cardiovascular device that sustains cardiac function is of high interest from an ethical standpoint. The American Academy of Hospice and Palliative Medicine outlines there are 4 conditions where ICDs can be disabled. This is when ICD is inconsistent with patient goals, when withdrawing antiarrhythmic medication, when death is imminent, or when a do not resuscitate order has been made. Disabling an ICD in a patient may result in rapid death, which can be ethically challenging to a doctor who may not believe it's ethical to switch off an ICD when there is the possibility of sustaining that patient's life. A 2015 study found ICDs to have a complication rate of around 9.1%. There are safety risks that exist during the surgery, as well as complications specific to the ICD device, which require surgical correction. Lead dislodgement refers to a change in the position of the leads within the heart. Lead electrical malfunctioning is an abrupt change in the lead resistance, electrogram amplitude, or threshold without changes in the lead position, as well as lead perforation is detected by an acute stabbing chest pain or trouble breathing. These all require surgical correction. Also, when ICDs deliver a shock to the heart, there is the possibility of the device administering an inappropriate voltage or number of shocks, which poses safety risks to the patient. This occurs in as many as 1 in 3 patients.
The device alone costs around $22,000, and costs associated with its implantation, the need for ongoing 6 monthly device checkups, and battery replacement every 8 to 10 years may serve as a financial challenge for individuals. An example of subsequent costs post-implantation may be due to lead failure and device infection, which are typical long-term problems associated with ICDs. So while ICDs serve as life-sustaining technology and are proven effective for patients at risk of ventricular arrhythmias and sudden cardiac death, its cost may function as a barrier. So, because of the high cost associated with the ICD, they are commonly viewed as an expensive therapy. A study found that individuals aged 18 to 40 years old had concerns regarding ICD-related costs, expressing their fears of not being able to offer financial security for their families. Moreover, as the indication for ICD therapy expands, an increase in the potential number of implants also follows, which may cause a financial burden on the healthcare system and limit their adoption to everyday clinical practice.
So, in conclusion, ICD has been successful to reverse cardiac arrhythmias such as tachycardia and fibrillation. However, this treatment could still possibly affect mental health state due to safety, cost, and clinical maintenance for both the patient and the healthcare systems. Therefore, it still requires further improvements in terms of cost and safety in the future. So that's it for today. Thank you very much for your attention, and we wish you good luck.